Good evening, everyone. I'm Simiran Choudhary, and I welcome you all to the panel discussion Vaccinate, Educate, Prevent, a dialogue on HPV awareness. As we all know, January is the Cervical Cancer Awareness Month, a time dedicated to raising awareness about one of the most preventable cancers affecting women worldwide. Yet, in remains one of the leading cause of cancer-related death among women due to low awareness, limited screening, and barriers to HPV vaccination. Today, we have a distinguished panel of experts who will shed light on the critical aspects of HPV, cervical cancer prevention, and the steps needed to drive greater awareness and action. We will explore the science behind HPV, discuss barriers to vaccination, and identify ways to integrate HPV education into routine healthcare and public health initiatives. So, this discussion is not just about facts and figures, it's about saving lives through knowledge and advocacy. So, let us begin with this essential conversation. I would like to introduce my speakers for today's panel discussion. Colonel Ajai Tomar, CEO of Indian Cancer Society Delhi branch. Welcome to our show, sir. It's pleasure
Thank
to
you.
have you with us. Thank you, sir. Dr. Gandhali Deorukhkar, consulting gynecologist and obstetrics at Wockhardt Hospital. Welcome to our show, ma'am. Thank you. Dr. Vishnu Agarwal, Onco-Gynecologist, Saifee Hospital, Mumbai. Welcome to our show, sir. Dr. Aabha Bhalerao, consulting senior gynecologist at Ruby Hall Clinic. Welcome to our show, ma'am.
Thank you.
Thank you, ma'am. It's a pleasure to have all of you together here to discuss and raise awareness about HPV vaccine. As we were talking before the discussion started, that the awareness around this is very low. People does not know about it. Even the females, if we talk about, does not have much of the knowledge. But it is an important aspect of every woman's life to know about it and how can they prevent this cancer. So I would start with my first question to Dr. Gandhali. Dr. Gandhali, what is HPV and how does it lead to cervical cancer?
Hello, everyone. I'm glad we are starting with the basics first because many people are not even aware what is cervical cancer and what is the full form of HPV. So, HPV is short form for human papilloma virus. More than 6 lakh 30,000 cases of HPV have been reported worldwide, 5% of which are cervical cancers contribute to 5% of all the cancers, as you know by now. According to the WHO, in 2020, there were almost 3 to 4 lakh deaths only due to cervical cancer alone. So now you can understand the extent and the importance of creating awareness about this HPV virus. So human papilloma virus, it is a virus and it is more than group of 200 viruses, we would say. Some of them are high risk, some of them are low risk. The low risk viruses essentially do not lead to cervical cancer, but they can cause sexually transmitted infections like warts, which could be genital warts, anal warts, oral warts, or warts in the throat area, which is known as respiratory papillomatosis. The high risk HPV types are 16, 18, 31, 33, etc. And these are the high risk types which can sexually transmitted can lead to cervical cancer. HPV 16 and 18 are mostly responsible for causing cervical cancer. So this HPV infection basically passes between sexual partner transmitted through intimate skin contact. It is either vaginal to penile contact, through anal contact, or through oral contact. So this is the basic of HPV transmission and how it causes cervical cancer. So the virus, when it affects the organ, the cervix, that is the mouth of the uterus, it can infect the thin flat cells, mostly the squamous cells, what we call, that lives in the inner surfaces of the cervical area, and this can cause and lead to cervical cancer. Some of the cervical cancers due to HPV infection of the glandular cells, they are called adenocarcinoma, but most of them are squamous cell carcinomas. Over 75% of vaginal cancers are due to HPV. Over 90% of anal carcinomas nowadays, the studies have proven, are due to HPV infection. So we can understand the extent and the importance of this HPV virus causing cervical cancers.
Thank you so much, Dr. Gandhali, for explaining us from the start, from the basic, what exactly is HPV, and how does it affect our body and turns into cervical cancer. My next question is to Dr. Aabha. Ma'am, are all HPV infections dangerous? And what are the key risk factors for developing cervical cancer?
As Madam has just told us, all HPV infections are not dangerous. See, HPV is a virus which has got 150 subtypes. So out of them, only 16 and 18 are the most dangerous. So non 16, 18 are not much dangerous, but out of them also, apart from 16 and 18, there are other 8 to 10 subtypes which can lead to cervical cancer. Rest are the low risk HPV viruses. So each and every one of us catches this infection sometime in our lifetime, but usually it leaves the body within 2 or 3 years if our immunity is properly working. But sometimes it fails to leave our body, and then it leads to the persistent HPV infection, which leads to the cervical cancer ultimately. So everything depends on how your immunity is working. So the conditions which compromise our immunity will predispose us for the development of cervical cancer. So, such conditions are mainly the HIV and AIDS, which leads to compromised immunity, the low socioeconomic status, which because of the poor diet and poor protein intake leads to the compromised immunity. Also, poor hygiene leads to the cervical cancer. And other things which predispose are the early age of onset of sexual activity, multiple births, and lack of knowledge.
Thank you, Dr. Abha, for explaining us how this infection is dangerous and how it can affect. Moving on to my next question to Dr. Vishnu. So, what are the early signs and symptoms of cervical cancer, and how can women detect it early? That okay, if these are the symptoms, then this is the time to visit a doctor, to visit a gynac, and it could be something else rather than just a day-to-day regular, normal thing.
Yeah, thank you. So, cervical cancer is like you can divide into ages of life, like postmenopausal and premenopausal. When the patient is postmenopausal, then the most common symptom is the postmenopausal bleeding. Means the bleeding has already stopped because of menopause, but still the patient starts bleeding. That means there is some cause, and it's either the endometrial cancer or a cervical cancer. So postmenopausal bleeding should not be neglected, and it always should be investigated by a gynecologist. Okay, so that is the main symptom of cervical cancer. In premenopausal, the bleeding anyway there is regular bleeding, monthly bleeding is there, but if there is a bleeding in between the two periods, or if there is excessive bleeding, or if there is a bleeding for a prolonged time, so that again may be the symptom of cervical cancer. So the bleeding is the most common symptom. Other symptoms may also be there, like there may be pain during intercourse. So that is also one of the very common symptom, because of the friction there is a pain because of the cancer. So that is another symptom of cervical cancer. Other symptoms may be like if there is an advanced cervical cancer, then it may cause pain in the pelvis area, or if it has spread to other areas like the bones or lungs, then it may cause symptoms to those areas like bone pains or like breathlessness, or if it has caused water accumulation in the abdominal cavity, it may cause bloating of the abdomen. So these are advanced symptoms. But main symptom is bleeding, that is excessive bleeding or unnatural bleeding. That is the main symptom of cervical cancer. And next question, yeah, how to detect it early? So first of all, it's an awareness of the patient. Of every woman should be aware that what is the symptoms of cervical cancer, as I explained. And secondly, there is a concept called screening of the cervical cancer. So it's recommended that every 3 years pap smear should be done, and every 5 years HPV testing is done. And nowadays it's recommended that even if you do every 5 year HPV testing after the certain age, 21 years of age, then their chances of getting cervical cancer and mortality because of cervical cancer will be almost nil. So that is very important that if we screen the patients every 5 years, then patient we can definitely avoid the development of cervical cancer, because we will detect the precancerous lesions. Like we call it cervical intraepithelial neoplasia 2 or 3, where we can do a local treatment and prevent it from developing into the cancer. So this is very important that one thing is symptomatology and second is screening is very important for females.
Thank you so much, Dr. Vishnu, for explaining us what are the signs and symptoms, as it is very important to understand the signs and symptoms, and because of with that only we can take some action on it. So my next question is to Colonel Ajay Tomar. So what is the current level of awareness about HPV? Like, since we're talking about basic awareness, what exactly is HPV and everything. So you deal with public, you know the aspects of how much awareness is there on the ground, how much the people know about it, how much they go for screening and everything. So what is the current level of awareness about HPV and cervical cancer among the general public in India, and what steps can be taken to increase this awareness?
Thank you. The general awareness in general public about HPV and cervical cancer is very, very low. And according to a study conducted by National Institutes of Health in Delhi NCR, I'll be limiting myself to Delhi NCR and areas around because we are a Delhi branch of Indian Cancer Society. So the study conducted by them revealed that only about 18% of the respondents were aware that there is a vaccine against cervical cancer. And cervical cancer क्या होता है पूछने से they'll say something around the neck. So that is the level of awareness which people have. And another study conducted amongst the school children and the college students by another group in Delhi NCR revealed that only 15% were aware of HPV and cervical cancer. And once told that it is highly preventable if you take vaccination on time. So only 13% of the respondents were ready to take the vaccine. So that shows how much illiteracy is there even amongst the students of schools and colleges. And of course, the parents are also involved in this study. So now, since the level of understanding of this disease is so low, and this is one cancer which is 100% preventable and also treatable if detected early. So, what to do is we have to have some campaign, some strategy, not at state level, but at national level, like on TV, on videos, on we have got a mobile app also, by the way, known as Rise Against Cancer. So we spread awareness about cervical cancer and other cancers also through mobile app. So it's a digital world now. So we have to use the social media and the traditional print and news media to spread awareness about this dreaded disease, which is so much preventable. So I think another thing is that we go out to communities before we do a screening camp. We tell them, we give them IEC material, leaflets. कि भाई, this is cervical cancer. It is curable. Please come forward. It's a very small little test, pap smear, HPV DNA, like Dr. Bhalerao was telling that it is preventable. So we tell the same things to the people, and we urge them to come forward for the screening. The first step is awareness. Only once they are aware and they're ready to undergo screening can the next step take place. That is the prevention.
Thank you, sir. Thank you so much for clearing us on the aspect, like what is the current level of awareness and how we can create more awareness. And I think you pointed out very rightly. One is going through community, interacting with the community through leaflets, to going to educate about, and the other thing is the social media campaign. Everyone, I believe, young, old, or a kid, everyone is on social media. So
That's
they
right.
know everything what is there on the social media. So I think social media campaigns, some awareness reels, interacting reels, and everything can help us to understand or make them aware what exactly is it cervical cancer and how dangerous it can be if not action taken on time.
That's right.
So yes, thank you so much, sir, for emphasizing on that. Moving on to my next question, Dr. Gandhali. Ma'am, you see a lot of patient in your daily life, and you would have come across different situations. So if I have to ask you, how do you approach counseling patients and parents about the importance of HPV vaccination, and what role can obstetricians and gynecologists can play in increasing the awareness to take up the vaccine among young girls? So how do you do that?
Yeah. So, good question. And like Colonel Tomar sir has correctly told us, we are in a digital world. We are staying in a digital world. So, digital world really helps us to spread a message quickly across all the masses and the classes of the society. I do see a lot of patients with unhealthy cervix, and I'm sure Dr. Aabha does too in her daily practice. So when we, so now I have made a column in my daily history taking about HPV vaccination, whether the patient has taken the HPV vaccination or no. So when I'm taking my history of the patient, I naturally ask them whether they have taken HPV vaccine. And you will be shocked and surprised to know most of them ask me, what is that vaccine? They're not even aware that such a vaccine exists. And then I tell them and educate them automatically as to what is HPV and how it can lead to cervical cancer and some kind of sexually transmitted diseases. So I automatically, every time when I ask that question, daily, day in and day out to each of my patient about HPV vaccination, I educate them at the same time. Most of the mothers in urban areas are aware about the HPV vaccine. Currently, it is a norm in the routine immunization schedule by to the vaccine to be given by the pediatricians. So between 9 and 16 years of age group, most of the girls in the urban areas are vaccinated. There are two shots of vaccine to be given, and most of them I find in urban areas are already vaccinated. The vaccination is not given to the boys in that age group somehow is what I feel. So I feel we should emphasize even the boys taking the HPV vaccine and not only the girls. That is what I feel. Secondly, in routine, as doctors, we rely mainly upon up-to-date John Hopkins Medicine or Mayo Clinic. So all of these have patient leaflets. So I print out these leaflets and I keep it in my routine practice, and I hand it over a leaflet, a patient information leaflet, to my patient who does not know anything about HPV or cervical cancer due to HPV. I think that leaflet helps a lot. They read that leaflet. It is a one page thing, it is not too boring or something like that. And the patients definitely get more awareness by reading that. Apart from that, in our daily routine practice, there is always a TV monitor outside our clinics. We can run some reels or some stories or some information regarding HPV vaccine and their awareness as to how HPV virus can infect a normal cervix and can cause cervical cancer or oropharyngeal cancer or anal cancers. So we can do that. Apart from this, we do go to schools and colleges routinely. Wockhardt does conduct programs routinely in our nearby schools and colleges and some corporate offices too. So we do create awareness about cervical cancer through school and college talks. Like Dr. Colonel said, we have a mobile app now to raise awareness, and all the children are very social media friendly. They are on Facebook. Sorry, they are not Facebook generation anymore. They're on Instagram actually.
Yeah.
So I think social media awareness about cervical cancer, like how we have breast cancer month, we have a cervical cancer month. January is the cervical cancer month. So do that. Quiz competitions, slogan competitions, all this can make awareness. We can have some celebrities or influencers talk about cervical cancer and HPV. This is how we can create more awareness in the society. Is what I feel.
That way we can approach or target more and more people. As influencer theory, yes, it works a lot. But ma'am, my follow-up question on you is that you said that it's very important to motivate and educate young girls about it. And most of the girls from 9 to 16 years of age group rely on the pediatrics or the immunization thing, and whatever the doctor will recommend to them, they will go for the immunization. But what about the girls who are into this rural areas? Those do not have that much of awareness and access to the vaccines. And we all know the vaccine is quite expensive. So yes, urban area, most of the urban people can afford that, but the rural persons are. It's very difficult for them to uh, get that vaccine by themselves until unless it has been enrolled in the immunization program by the government. So how can we address that gap?
Yeah, so most of the times, this vaccine is not limited to 9 and 16 years of age group. The vaccine can be taken up to the age of 45. So we can definitely, there are many government programs which Colonel Sir will make us aware from the Indian Cancer Society, that these vaccines are given at a subsidized rate to the rural PHCs, and therein they can vaccinate the rural girls. And this vaccine can be taken by girls, women up to the age of 45 years. They are given 3 shots of vaccine, not 2 shots of vaccine. So I'm sure the government of India has a program for rural women also and rural girls also.
Thank you so much, ma'am, for explaining us that. Moving on to my next question, Dr. Vishnu. So, how effective is the HPV vaccine? Since we talked a bit about HPV vaccine, that this cancer is preventable because we have the vaccine available. So, if we talk about the effectiveness of this, how effective is the HPV vaccine in preventing the cervical cancer, and what age should it ideally be administered? Like, ma'am explained us that, but if you can elaborate to us.
So see, the cervical cancer, as already said. So almost all the cervical cancers, the primary cause is HPV virus. So that is the main cause of the cervical cancer. So if we deal with this virus, then definitely we can prevent. Totally, we can wipe out the cervical cancer from the world. So this virus, it causes the changes in the mucosa, which leads to development of the cancer. So this virus, when we target, when we do a vaccine, when we give a vaccine, it produces antibody, which these antibodies then kill these viruses and allow these viruses to grow. So that is how the vaccine works. So if we give this vaccine at a proper age, when the female is not exposed to any virus in her life, that is the best time to give. And if we give that vaccine at that age, then it can totally prevent the cervical cancer. I was recently reading one article, like in Scotland, they have totally removed the totally wiped off. The cervical cancer is not there at all because everybody is vaccinated. So it is like that much effective, that vaccine. And now coming to that, age is very important, that when it should be given. So it would be given before the female has sexual life actually. So ideally it should be given at the age of 9 to 11 years. That is the most ideal age it should be given, because it should be given much before the sexual life begins actually, so that it can create antibodies which can fight the virus when the patient is exposed to that virus. But if it is not given at this that is age, and that at that age you can give only 2 shots, and that is enough, and that is enough for the life. You don't need to repeat those vaccine again. So but if the patient has not taken and the female comes to us that we have not taken at that age, and we are now already 25, 30, already our family is there. So at that age also we can give vaccine, although it will not be so effective, but it can affect. If the patient is not exposed to HPV virus earlier, that will be equally effective. Even if the patient is exposed to HPV virus, there are some strains which she may not be exposed to those strains, so it will be effective against those strains. So definitely it will reduce the risk of cervical cancer if it is given at the age. So up to 45 years, like madam said, 45 years, it is recommended we can give vaccine. Although the awareness is very important, that it should be given at as early as possible, as between 9 to 11 years is the best. So awareness plays a very, very important role, so that we can totally wipe out this cervical cancer.
You pointed out rightly, sir. Awareness is the key role here, so that we can also wipe off cervical cancer from our country. Moving on to my next question, talking about more on prevention and awareness to Dr. Aabha. Ma'am, what are the primary barriers that are there in preventing HPV vaccination among adolescents in India? And how can healthcare professionals work with schools, society to integrate this HPV awareness program into their curriculum? As I believe you face this every day, every time whenever this question would has been asked. Okay, what the I believe you are tired of explaining everyone what exactly is HPV, to educate them, to make them aware and how important it is. So what are your views on this?
Yes, I completely agree with the speakers about their experience about public apathy about this virus. we have been trying for so long to make public aware of this virus, its implications, and the vaccination, but somehow we are not able to make an impact. So I completely agree with Dr. Gandhali when she said influencers have a major role to play here because the target population is 9 to 14 years. They get influenced by the media influencers, and so this is the right time they come into the action and try to grab the attention of those that age group. Because we being gynecologists, when the age group which we cater to is 18 to 18 onwards, so those are the mostly they have crossed the age limit. That is the target population, 9 to 14. Of course, catch-up vaccination can happen till the age of 45, but the most difficult situation is the cost effectiveness of the vaccine, because indigenous vaccine is cheaper than the Gardasil, which is foreign made, but the studies available are till the age of 26 only. So till the age of 26 only, we can advise to go for Cervarix, the indigenous vaccine, till the studies are made available for up to the age of 45. From 26 to 40, we have to go for Gardasil, which is costly. And for boys, when we advise nonavalent vaccine, it is even costlier. So the cost effectiveness is the major stumbling block. The government will have to deal with that. And when we go to the schools, when we go to the corporate offices, when we keep on talking every Women's Day and Women's Month, that March, about HPV, since long we have been doing this, but we somehow are failing to make an impact. So maybe the influencers can help us in a big way. And it's a time when the community comes, joins hands together with us and help us motivate people. Because we will be motivating parents. We should be motivating the main target age group of 9 to 13.
I think if we can educate our parents, the current youth, most we would have target more than 50% of our population of the country on awareness regarding HPV and cervical cancer. Ma'am, a follow-up question. Since you also interact with your patients on daily basis and try to educate them about the vaccine which is available, so what all hesitancies you have come across while you are educating them and motivating them to get this vaccination done? So what all questions or this hesitancies come around?
First of all, is the severity of the implication. They do not know what the virus is. They fail to understand that it can lead to cancer. They don't want to believe that it is the only cancer which is preventable by vaccine. And once, when out of 10, we are able to convince 2 or 3, then the cost is the barrier. Then somehow, sometime they come for on their own for taking vaccination, they miss the date of the booster doses. So these problems keep on coming with any vaccination, but especially with HPV, because there is no community pressure, there is no peer pressure, and the follow-up by the parents is also poor.
Thank you, ma'am. Thank you so much for answering that question. Moving on to my next question to Colonel Ajay. Sir, what has been the Indian Cancer Society's approach in spreading awareness about HPV and cervical cancer? So you're on mute.
We have been going to schools, colleges, social media, leaflets, all that I have covered. Now I'll go ahead of that and say that we have to step into advocacy, which we are doing as Indian Cancer Society. We contact big organizations like Foxy and Pediatrics Association of India, that they should also raise their voice to the government and implement that national, that it should be, vaccination should be included in the national immunization program, which it almost declared it will, but somehow it has been delayed. This process has been delayed, but sooner than later it will be included in the national immunization program. So we have got radio talks also. I have covered mobile app, I have covered advocacy now, and it is basically you have to go out, and it has to be like a big campaign to make people aware, because even if the government gets the vaccine free of cost to the children aged between girls between 9 to 14, still if people are not ready to take it, it will be pointless. So our focus as Indian Cancer Society is to go amongst the masses and educate them not only about cervical cancer but other main cancers, head and neck, आपका, gynae cancers, and of course, gynae cancer may this is included. So this is how we approach the community, and we hope that one day people will become aware, and the government will also implement cervical vaccination as a national program, and things will be better. There are few states like Bihar. Bihar has started this
Yes.
immunization program. Sikkim and Punjab, I don't know whether why I was speaking to Dr. N. Arora of Entegi. So he was saying the actual problem is not of the cost, because if India could grapple with things like COVID and vaccinate masses in such a manner, so cost is not the factor. It is the infrastructure and the readiness of the people to take the vaccine. That is a major hurdle.
I
So I
think so.
think these are the points which we are focusing on as Indian Cancer Society.
I think the major lacking is the awareness and the readiness to accept that vaccine. But I
Yes,
have to ask about, sir, like you also mentioned about it, one day it will be included in a national immunization program. My question to you is one, what is the delay behind when everyone knows, even the authority knows that how important this is? And yes, we have a vaccine to prevent this cervical cancer. Then why aren't we involving this despite our in a previous budget? I believe this was mentioned in the budget, in a healthcare budget, does that HPV would be included somewhere in the immunization thing. And second, if Foxy and Indian Association of Pediatrics are working on it, IMA are working on this to get this included into our immunization program, then what is the barrier coming there? Because if awareness and readiness is the only thing which is where we all are lacking, then why is government not making into this compulsion that every female of this to this age has to take this vaccination?
yeah, it's a very important question. Of course, budgetary constraints would be there, but according to Dr. Arora of Entegi, what he said that more than that, it is the hesitancy on part of the people, those who want to take. They don't want to take vaccines. This is one of the thing, and then infrastructure which has to be developed. If it is to be a nationwide program, so that infrastructure should be in place to administer this vaccine to all. And another thing which he told me, and probably we doctors would be aware, that Cervovac vaccine of Serum Institute of India, they claim that it will be one dose for the age of children between 9 to 14, but the trials have not been completed at ICMR. I think this is also one of the hurdles in making this into a national program. I'm not very sure. Maybe other doctors would clarify out the state of Cervovac vaccine and whatever the studies are going on about its efficacy of one dose versus two doses.
Thank you so much, Colonel Tomar, for answering my question. Now we'll move on to my next. Yes, ma'am.
I just wanted to add, Simiran, one thing. We have talked about awareness about HPV vaccine, cervical cancer, everything. We haven't talked at all about this taboo in India about talking about safe sex practices amongst our children. I think as parents, should have an open dialogue with
That's
our
right.
teenage and our children, mainly at home. They will be educated in schools and colleges, like Colonel said, and we do that also. And those sex habits have to be discussed by parents with their children at home. Many children get sexually active at a very early age nowadays, is what our observation is as
Yes.
clinicians. And whether to use a contraception, which contraceptive is the best, all these things have to be discussed practically by parents with their children one on one, or either the parents can get their children to the gynecologist or to their doctors who can have an open dialogue with the children, is what I feel. Importance of sex habits, safe sex habits, is a must in today's era and with today's generation, is what I feel.
That's a very valid and strong point, ma'am. If this has been discussed at home and parents aware their children that what are the safe sex habits, what should has been done and what not. So I think that way, kids are more educated. Young people are more educated towards what to do and what not to do. And this should be more open kind of conversation in schools, colleges, and everywhere. And I believe it's just there in the textbooks, not in way where people are, it's been a discussion there why it is required, why not. It's just has been a textual book, textual concept. So I think a more open dialogue is required here. And thank you so much for mentioning that. Moving on to my next question to Dr. Gandhali. Ma'am, how can we integrate HPV vaccination into our routine gynecologist checkups and parental care? Prenatal care, I'm sorry.
So we do routinely pap smear, like Colonel Sir has already emphasized upon routine screening of patients. We do pap smear screening of all women, irrespective of their age. Nowadays, we do the current guidelines state that we should do pap smears of every woman who is sexually active. So yearly, once a year, routine pap smear screening, and if the cervix is unhealthy, HPV screening too. It is a 1 minute procedure done on OPD basis. I think that is a must. We should emphasize on that as clinicians. If the cervix is unhealthy, there is something called as a colposcopy examination also, which can be further explained to the patient the need for a colposcopy examination, the need for cervical biopsy. Dr. Vishnu Agarwal would agree with me completely that if it is caught early with a biopsy or with a colposcopy examination, cervical cancer is treatable. And I think we should emphasize as clinicians on these routine checkups on a day-to-day basis without fail, without being in a hurry with a patient, and to explain to the patient what is an unhealthy cervix and what is the need for this screening beyond a routine pap smear. I think that would solve a lot of issues further, and we can catch it at an early stage and it can be treated at an early stage, is what I feel.
Thank you so much, ma'am, for answering that and elaborating us to in a very layman language. And I believe that's the way, if a patient is not aware, if a person is not aware when they goes to a doctor, and that education is given by the right person in right terms and language, that's a better way of understanding it. So thank you for answering. Moving on to my next question to Dr. Vishnu. Sir, are there any new research developments in HPV related cancer treatment and prevention that we should be aware of?
Yeah, so the recent research has shown that there are two ways of cervical screening actually. One is the cytology, another is the HPV testing. So the research has shown that HPV testing is much better than just doing cytology, or we can do both, either both cytology as well as the HPV testing. But if we are doing one, then HPV testing was better than the cytology. It is more sensitive, and so that is one of the recent research has published, and they have said that even if you do at 5 years HPV testing as a 5 years of interval, because it takes a long time before the virus going into the cancer. So 5 years is a good enough time to do the cervical screening, which HPV. So that is the recent research which has shown that how we can prevent cervical cancer if we do the screening at 5 years period with HPV virus, detecting HPV virus. That is one thing. Regarding the treatment part, so now there are various treatments in experiment. Not they are not even published yet. They are not ready for the use. But there are some vaccines which are being developed, like mRNA vaccines, and there are some immunotherapies which have been developed, which strengthen our immune system to fight the cancer. So that these are especially against the cancers caused by HPV virus. It may be cervical cancer or maybe other cancers also, like anal cancers or oropharyngeal cancers. There are various therapies being developed, like there are dendritic therapy, immunotherapy. They are all in pipeline, which may come in future, and some are already being used. Like in head and neck cancers, we are using immunotherapy for especially for HPV related oral cancers. So that is what is coming in for the cervical cancer also in future, that we can use some vaccines. Now we are using vaccines to prevent the cancer, but we are also in a experimental way to develop vaccines which can even treat the cancers. So like immunotherapy and mRNA vaccines which are being developed. That is one thing. I would also, because we are discussing about cervical cancer, so I would also like to just tell in a brief what is the treatment of cervical cancer. So firstly, it is detecting cervical cancer. So we have already, Dr. Gandhali madam said that we do the first examination of the cervix, whether it is a healthy or unhealthy cervix. Then we see whether it is healthy cervix. Then we may do a colposcopy, and we may take a colposcopy guiding. What is colposcopy? It is to visualize the cervix very nicely, and if there is any abnormality seen, so we take a colposcopic guided biopsy whether there the unhealthy cervix, and then we test it whether it is so it may be carcinoma in situ, which is a precancerous lesion. So recently, one patient was there which I operated. She just went for a because of her daughter, she went for an annual health checkup, and it was detected CIN3, which is a precancerous lesion of the cervix. And then she went to Tata. Then she came to Jaslok. I did because she was postmenopausal, so we did the robotic hysterectomy, and so the patient was totally cured now. She doesn't need any other treatment, and then so that is the thing how the annual checkup helps in preventing cervical cancer. And if we detect early, we can do even local excision also. We can do which is a precancerous lesion, or we can do like a postmenopausal patient. We can do a hysterectomy. It depends on that. But when there is a frankly there is a cancer of the cervix, then if it is a early stage, very early stage, limited to the cervix, we can do the surgery. We can do even minimal invasive surgery wherever is indicated. So patient doesn't have to stay in the hospital for a long time. We can do laparoscopic robotic surgeries for that, or we can do open surgery depending on the patient surgeon's expertise and all. And then, but if it is little advanced, so then the surgery is not indicated. In those cases, we go for radiation. Radiation is the main treatment, and along with the chemotherapy. So that is the treatment for little advanced stage like stage 2 and stage 3. In stage 1 we can do surgery, stage 2, but if it goes beyond that fourth stage, then it becomes incurable, and then only the palliative treatment, maybe in the form of chemo radiation, we can give. But we can't save the patient and cure the patient, but definitely we can prolong the life. So again, the emphasis is that early prevention is most important, and then early detection is also very important. We want to treat the cervical cancer, and it is fully curable. There is no problem at all.
Thank you so much, Dr. Vishnu, for explaining us the process and what are the new research and developments there, and the upcoming the good news is which is that a cancer can be treated through vaccine, and the process you explained that. Thank you so much. It's very helpful in understanding the complete process, and how a person, if even got the cancer, how it can be treated and saved. So thank you. My next question is to Dr. Aabha. Ma'am, what are the biggest misconceptions surrounding the HPV and cervical cancer, and how can we address them?
There are plenty. There are only misconceptions around HPV. Hardly anybody understands what is HPV. So the first biggest misconception is only women can get HPV. No, boys also can get HPV in the form of warts. They can have penile cancer. They can have rectal cancers. Second is we can prevent getting HPV by using condoms. No, it is only partially true because HPV is transmitted by skin to skin contacts. So condoms cover only a partial genitals partially. So wearing condoms is not going to save you from HPV, although can save you from other sexually transmitted diseases, but not from HPV. Third one is if I'm not getting any symptoms, I do not have HPV. By the time you get symptoms, the HPV has progressed too far to CS cervix maybe, because initial stages HPV is not going to give you any symptoms. The last being, if I'm vaccinated, I don't have to go for routine screening with PAP. No, you still have to go for routine pap smear screening as well as co-testing with HPV DNA every 5 years or 3 years, depending on your previous results. So there are many misconceptions around it, and as and when people come to our OPD, we have to clarify those misconceptions with every visit of annual checkup, health checkup. Pap smear they routinely do. Then we'll have to advise him about the co-testing with HPV DNA also. So nowadays they have started at least listening to us that there is something advanced than the pap smear. Pap smear being advised traditionally, now we are advising them about HPV DNA. So hopefully we'll be able to clear their misconceptions sooner.
Thank you so much, ma'am, for shedding light on all the misconception and myths around HPV. And it's very important to clear all those things. Moving on to my next question to Colonel Tomar. So, what do you think HPV vaccination was not included as in India's national immunization? We discussed a bit about it and its proven effectiveness, and what measures can be taken to make the HPV vaccine more accessible and affordable for all the section of society, including urban and rural areas, and everyone.
Thank you. Before I answer the question, let me just tell you something about Indian Cancer Society and our efforts in by the Delhi branch.
So,
We have got a ongoing PAP Delhi project which started in 1999, and 25 years have passed, and we have made great strides in spreading awareness and doing vaccine and sorry, not vaccination, and doing cervical cancer screening. So just to cover the last year, we did cancer screening, cervical cancer screening of more than 5,000 women, 5,003 to be precise. And we use the gold standards of HPV DNA, and which Dr. Vishnu was saying that once in 5 years it should be covered. We did that on recommendation of a gynecologist, and for others it was pap smear. And those found with precancerous conditions were called to our cancer detection center. These screenings we did using our mobile vans. We have got mobile vans fitted with mammography machines and blood testing equipment, which goes to underprivileged areas, X-rays, and then we do the tests, and our doctors they are equipped to carry out pap smear test as well as HPV DNA. We don't go in for VIA any longer. So having caught the people young or rather early, we call them to a cancer detection center where we have got a collaboration with Carkinos, and we do the colposcopy. And you'd be happy to know that out of 5,000 odd screenings which we did, we treated 97 women, and their lives have been saved. We did thermal ablation using colposcopy and other treatment, and see and treat method. We saved 97 out of this 5,000 odd women which we did. So this was our efforts. Now coming to your question about what was the question about inclusion in how it can be made more available and
affordable for all
affordable.
sections of society.
Yeah. So I think the only and the best way is to include it in the universal immunization program, so that once the government efforts are pitched in, the things will become cheaper. Serum Institute of India has come out with a very good vaccine, and I'm sure very soon, at least the paper says so, that within 1 or 2 months, it will be included. Some states have already included the immunization program, and if it is included in universal immunization program, it will make great headway like COVID vaccination. And then there are see whatever good steps the government take, there are some reverses also to be faced. Some organizations are there. They say why we should give consent, why children, young girls should undergo this vaccination. So anti-vaccination groups are also very active, which scare away the people. So these groups also have to be handled, and they can be best handled by advocacy by the government and understanding by the men. Of course, it boils down to the same thing which we have been discussing. Awareness has to be at a very very mega scale. Then it should be a school-based vaccination program. 9 to 14, they go to the school, they interact with the parents, and then tell them, convince them that yes, school children, you have to undergo this. Parents should be convinced. Teachers will play a major role. So if it is implemented at school level, I'm sure this will become more effective and cheaper. Of course, like I said earlier, cost is not the factor, because once the government comes in, the producer, Serum Institute of India, or whoever produces, even if they have to get it ex import, they'll have to give a lot of subsidy and concessions. So cost is not a major factor as far as I think. Then partnership with international organizations like we have with UICC and other. uh, We are Indian Cancer Society is part of consortium for cervical cancer elimination in India. There are a lot of groups, CAPED, and so many other organizations are there with common aim to focus on cervical cancer and to get the government into starting this universal immunization program. We have submitted a 100 district plan to the government. Once you decide, this is how you can go about. It's a white paper, many hundred pages of white paper which has been submitted, which gives step by step process to be undertaken to make this program a success. So there is no time to discuss all that. But suffice to say, methods, processes, and will. The only thing is willpower has to be there. Baki everything is in place. So I
Yes,
think it will be a grand success if we follow these guidelines, and I'm
you said
sure
it
it will come very soon. Thank you.
very well said, sir. And if I think the delay is maybe some of the those are the barriers which we are not aware of, and I think those we clear all those things. The government will clear all those things, and this will be soon included in our national immunization program. And like the COVID vaccination was a major success, and in a widespread way, it went, and I believe everyone got the shot of COVID vaccination. That
Yes.
way, HPV vaccination will also be done, I believe. One last question which just came out of my mind, Dr. Gandhali, if you can answer. Are there any side effects of HPV vaccine? Any patient who have administered got this vaccine, who they have come to you after complaining something or anything which is there?
No, never. Up till now in my practice, up till now, I'm yet to see any side effect. Like after COVID vaccination, we have seen some transient fever and little cough cold kind of reactions. With HPV vaccine, I have not seen any kind of reactions. It is a simple intramuscular injection to be given under aseptic precautions by the nurse or by the doctor. And I am yet to see any kind of pain or rashes or any kind of abscess formation or fever or any other reactions. There are none so far in my practice so far that I've seen.
So I believe there is no point to be scared about if
Not
the
at all.
vaccine is not suitable to any one of the patient, the one who's taking it. So there is no point of discussion there also. But thank you so much for answering my question. I would like to thank all my panelists. With this, we have come to an end of the Vaccinate, Educate, and Prevent panel discussion on HPV vaccination and cervical cancer awareness. Thank you so much. All your efforts have made to create awareness, to generate awareness around this important issue, and to create awareness with to our audience as more and more get aware of it, the fear, the hesitancy, and everything will go, and the readiness will be there to accept the vaccine and go for it. So thank you so much for coming to the platform, sharing your insights and views, because it matters a lot in educating on this important topic. So thank you so much.
It was
Thanks
a
a lot
pleasure.
for
Thank
having
you.
us on the panel. And I would
Thank you.
just conclude this by saying that health is only valued when sickness comes. So, an ounce of prevention is better than a pound of cure. So, I think we should encourage people, we should get them informed, get screened, and get vaccinated.
Very true, ma'am.
And I
Yes,
would
sir.
like to add on that screen the mother and vaccinate the daughter.
Correct.
True.
Agreed. True.
True point.
Thank you.
Dr. Abha, would you like to say something?
Yes, if you are between the age of 9 to 26, get vaccinated. If you are between 30 to 65, get HPV testing done.
Thank you, ma'am. Dr. Vishnu.
See, so the cervical cancer, even if you are not able to prevent, we can definitely treat if we detect it early. So even if the patient is not vaccinated and she gets, so better to get screened regularly. And if we can detect it early, we can treat with a very localized treatment. We don't have to go for a very major treatment for this. So screening is also very important. Regular screening.
Very rightly said, sir. So thank you so much for all your efforts, insights you have made to come onto this platform to create awareness with Voice of Healthcare. It's a pleasure to have you with us, and it means a lot to educate our audience who have joined us. So thank you, everyone.
Thank you, sir.
Thank you.
Thank you.
Thank you.